Welcome to the Exposure Magazine podcast from the heart of the British nuclear test survivor community. Welcome to this special edition of the Exposure Magazine podcast, where we delve into vital reports impacting our community. Today, we're unpacking the comprehensive evaluation of the Community Care Check, or CCC, pilot program, a groundbreaking initiative administered by the Nuclear Community Charity Fund, NCCF. This pilot, which ran from June 2023 to June 2025, aimed to research, develop, and implement a proactive outreach system designed to enhance the well-being of the British nuclear survivor community. The project was jointly funded by the Office for Veterans Affairs. Let's explore its findings. First, it's crucial to understand the British nuclear survivor community's enduring needs. This community is comprised of veterans and their families who have been profoundly impacted by the UK's nuclear testing programme, which ran from 1952 to 1991. This legacy of service has come with profound and long-lasting human costs. They face significant, multifaceted challenges, including long-term physical health issues include an increased risk of certain cancers, musculoskeletal diseases, and cerebrovascular diseases. A deep anxiety about potential hereditary effects on their descendants. A severe psychological burden, often characterized by exposure worry, a persistent anxiety related to invisible radiation and its uncertain future effects. In fact, 34% of this community meets the criteria for clinically relevant anxiety, which is more than double that found in other older men. They also experience anger and institutional mistrust, stemming from perceptions of negligence during the tests. This highlights a critical need for a relational approach that acknowledges their history of perceived denial and validates their experiences. Many carry feelings of guilt and responsibility for potential health issues in their families, adding an additional emotional burden. And finally, a significant social isolation stemming from the Official Secrets Act and the unique nature of their service. With these enduring needs in mind, let's look at the purpose and genesis of the CCC pilot. The NCCF launched this pilot with a clear objective: to transition from a traditional, reactive, application-based support model to a more proactive approach. The pilot received substantial funding, including a grant of £70,000 from the Office for Veterans Affairs, or OVA, which was matched by NCCF's own reserves. This funding came with a specific mandate: to distribute small grants for independent living and facilitate outreach to check their situations and deliver support directly. Now, regarding the pilot implementation and performance, an operational framework was established between June and December 2023. Key steps included the appointment of Mr. Ian Higginbottom as the outreach facilitator, the development of bespoke data management systems, including mobile applications, and the identification of a target cohort of 244 individuals. Proactive outreach officially began in January 2024, utilizing a phased strategy and communicating through Exposure Magazine itself. The report details several key quantitative performance indicators from January to June 2024. These figures provide a clear picture of the pilot's reach and impact. Perhaps the most striking finding regarding significant disconnection was that 43%, or 107 of the initial 244 individuals, had missing or outdated contact information. This revealed that a substantial portion of the community is hidden and untraceable by passive systems. Despite this, there was high engagement. Out of the 137 beneficiaries with available contact details, 115 were successfully contacted, with only 16% opting out. That's an 84% engagement rate. The pilot also led to an increased applications for support, showing a 26% rise compared to the CWI fund during the same timeframe. Notably, there was a higher grant value. The pilot saw an 86% rise in the average grant value, which was also 42% higher than grants awarded the year before the pilot began. One of the most significant insights from this pilot was the strategic pivot from transactional aid to relational care. A pivotal realization occurred in June 2024, when the outreach team understood that simply providing one-off financial support without ongoing engagement risked creating feelings of abandonment and isolation among vulnerable individuals. This led to a fundamental shift for the NCCF, moving away from a transactional model of one-off financial support towards a relational care model, focusing on the development and maintenance of long-term, trust-based relationships as the primary intervention. This evolution is strongly supported by established principles in social care and veteran mental health research, which demonstrate that continuous, person-centered support leads to better and more sustained outcomes. Social support is explicitly linked to a 22 to 32% reduction in psychiatric disorders and suicidal thoughts. The report highlights that the NCCF fundamentally shifted from being primarily a funder to becoming a carer, making this the most significant strategic outcome of the pilot. Parallel to the direct outreach, the NCCF also launched the BNTVA Connect initiative in early 2024. This was a crucial step to fill the void left when the British Nuclear Test Veterans Association, BNTVA, ceased its welfare and community functions. The inaugural Nuclear Community Convention was a resounding success, attracting nearly 100 community members, many of whom had never attended such an event before. BNTVA Connect delivers several key benefits. Community integration, by combining individual welfare with collective community activities. Fostering peer support is vital and cannot be replicated by civilian practitioners. Reduced isolation effectively addresses a major challenge for community members. And importantly, identity reinforcement, recognizing and validating the community's unique identity and need for recognition. On the financial activity and provision side, the initial program budget was £100,000, comprising £70,000 from the OVA grant and £30,000 from NCCF's own contribution. The final program spend, however, showed an overall overspend of £16,650. This was mainly due to the increased BNTVA Connect activity, but it was successfully covered by the NCCF's surplus in their grants allocation budget. In terms of direct support, a total of £160,165 in grant funds was allocated explicitly to beneficiaries under the CCC pilot, covering a wide range of goods and services such as home modifications, like wet rooms and heating systems, mobility support, including mobility scooters and accessibility equipment, and various healthcare needs, such as dental care and medical support. Looking to the future, the report makes several key strategic recommendations for national expansion. These are crucial for building on the pilot's success. First, to formalize and scale the relational care model. This means implementing a phased national rollout of the CCC program, making sustained, proactive, relationship-based support the charity's core operational method. This will require a significant investment in recruiting and training a national team of outreach facilitators. Second, to integrate community and remembrance activities. This involves establishing BNTVA Connect events as a permanent and funded part of the national program, including an annual national convention and smaller regional gatherings to encourage peer support and reduce social isolation. And third, to develop a tiered befriending service. This would involve volunteer recruitment, creating a structured befriending network of trained volunteers, providing complementary support to professional outreach, and offering long-term companionship in a cost-effective manner, especially for lower-intensity support needs. Finally, the report includes important digital strategy recommendations. To maintain connections and build community, it's recommended to enhance digital and communications outreach. This means strategically investing in platforms like Exposure Magazine to support the relational model through both in-person and digital interactions. This dual approach is essential for an aging cohort with potential mobility issues, ensuring they remain connected and supported. The Community Care Check pilot program has undeniably ushered in a new era for the Nuclear Community Charity Fund, shifting its focus from being primarily a funder to becoming a true carer. The insights gained and the strategies recommended lay a strong foundation for a more proactive, relational, and supportive future for the British nuclear survivor community. Thank you for joining us on this special Exposure Magazine podcast. We hope this deep dive into the CCC pilot report has enhanced your understanding of its profound impact and future potential of the NCCF and OVA-funded project. Thank you for joining us today as we bring Exposure Magazine to life. Like, subscribe and share for more great podcasts.